time. But what if, at least for some aspects of aging, we didn't have to? Imagine if the loss of heart size and the stiffness that often comes with aging could be reversed, even well into late middle age. And not by a little, by a lot. Today's guest, Dr. Benjamin Levine, has shown that with the right exercise protocol, people who were sedentary most of their lives could reverse up to 20 years of heart aging. Dr. Levine is one of the world's leading experts in understanding how the heart adapts under a variety of conditions, whether that's exercise, elite athleticism, or hospital bed rest, or even highly exotic conditions like prolonged exposure to microgravity. He is the founding director of the Institute for Exercise and Environmental Medicine at UT Southwestern in Dallas, a leading facility renowned for its research in cardiovascular physiology. His expertise also extends into space medicine, where he advises NASA, underscoring his broad, deeply fundamental understanding of how the heart changes over time. Additionally, he is a recognized authority in sports cardiology, consulting for organizations such as the NCAA, NFL, NHL, and various professional sports leagues. The implications of being able to reverse any aspect of aging are immense. But the key ingredient truly is committing to the process, doing the routine, sometimes boring stuff day in and day out, and sometimes embracing a little challenge too. Dr. Levine's research highlights the importance of ongoing commitment. It is one of his landmark trials that he and his team showed that participants who had been sedentary for most of their lives put them on a structured, graduated training regimen. This program culminated in 5 to 6 hours of physical activity per week, sustained over 2 years. Participants engaged in a variety of exercises ranging from high-intensity interval training sessions, like the Norwegian 4x4, to light aerobic activity on recovery days and strength training. The results were remarkable, demonstrating that it is possible to reverse significant aspects of heart aging with the right commitment and exercise protocol. But let's suppose for a moment our goal isn't just to bail ourselves out at the absolute last minute with some type of Herculean effort, and instead we ask ourselves what we should have been doing all along. What is the right routine to age best from the start? Dr. Levine's research also looked retrospectively at the hearts of individuals based on their self-reported activity levels over 25 years. It was the committed exercisers alone, those who consistently exercised at least 4 to 5 days per week, who saw significant benefits in staving off the gradual increase in cardiac stiffening and heart shrinkage seen later in life. This highlights the importance of exercise as part of your personal hygiene and provides insight into how much we should be exercising throughout our life to maintain heart health. However, as we push the boundaries of what our bodies can handle, some studies have raised concerns about the potential risk associated with extreme exercise, such as high levels of coronary artery calcification seen in marathon runners, and a greater risk of heart arrhythmia known as atrial fibrillation in veteran endurance athletes. Today, Dr. Levine will help us explore the balance between beneficial and potentially risky physical activities, clarifying how intense exercise regimens might influence heart health differently, and what this means for those who regularly engage in high endurance activities. We delve into whether the stabilization of plaque through exercise and intense exercise translates to lower risk of cardiovascular events, despite the higher calcification levels often reported. In this episode, Dr. Levine and I also discuss why 3 weeks of bed rest produces a functional decline that is actually worse for fitness than 30 years of aging, and also how bed rest affects the size of the heart, mimicking aging, how to make exercise a part of your personal hygiene, and some of Dr. Levine's key insights on how to do that best. His ultimate prescription for life, blending resistance, aerobic endurance training, and more conventional programming like CrossFit into one package to maintain a youthful heart even into older age. Whether CrossFit counts as endurance training, resistance training, or both. Why pure strength trainers should incorporate endurance training and vice versa. The number one sign you're overtrained. Dr. Levine's activity recommendations for recovery days. Practical lifestyle protocols for lowering blood pressure, why you shouldn't become an endurance athlete just to live longer, and so much more. As a companion to this episode, we've prepared a thorough guide on omega-3 supplementation that I think will be invaluable for anyone looking to understand this complex topic more deeply. It addresses the substantial benefits of omega-3s for cardiovascular health, confirmed by numerous randomized controlled trials. And it also tackles the nuances and potential risks, specifically the recent discussions around omega-3s and atrial fibrillation. In the guide, you'll find a rigorous examination of what makes a quality omega-3 supplement. Factors like purity, freshness, the bioavailability of different forms, and dosing strategies that can elevate your omega-3 index to a level linked through observational trials with a significant increase in life expectancy. We also provide a critical analysis of some of the top omega-3 supplement brands, evaluating them based on their performance in third-party testing to ensure you're choosing the most effective and safest options available. I highly recommend downloading this guide. It's available for free at fmfomega3guide.com. Once again, that's fmfomega3guide.com. Now, let's get on to the core of today's discussion, how exercise prevents and reverses aspects of heart aging with Dr. Ben Levine. I'm so excited to have you here, Dr. Levine, and there's many, many things that I really can't wait to talk about with you today, but maybe we can start with bed rest and the effects of bed rest on cardiovascular health. So you were part of one of a very, I would say, famous and informative studies, the Dallas Bed Rest Study.
Yeah, so actually I was only 10 years old when that study was first done. So my part arrived much later. Thank you for that very generous introduction. But, the cardiovascular community used to put people to bed after heart attacks or things like that. That was the standard of care. And in the mid-1960s, my mentors in Dallas, Jerry Mitchell, Gunnar Blomquist, and Bengt Saltine, some of the most famous cardiovascular physiologists ever, took 5 young men and put them to bed for 3 weeks and then trained them for 2 months. And frankly, almost everything we've learned about the cardiovascular adaptation to changes in physical activity began with that study. Only 5 guys. And so, like I said, I was only 10 years old, so I didn't participate in that study. But 30 years later, we found those same 5 guys and brought them back to Dallas to study them and to compare the effects of 30 years of aging with what happened to them during bed rest. And quite remarkably, not a single person, not one, was in worse shape after 30 years of aging than they were after 3 weeks of bed rest when they were in their 20s. So 3 weeks of bed rest was worse for the body's ability to do physical work than 30 years of aging. And that observation really started us on a whole series of studies trying to understand what's the difference between a sedentary behavior or lying in bed or being physically inactive and aging.
So when you say that the 30 years of aging was no worse than 3 weeks of bed rest in terms of, so what sort of physiological parameters are you talking about?
These were the 5 most studied humans in the history of the world in terms of all the studies that were done to them. But the sort of simplest is the maximal oxygen uptake. That's the maximal amount of oxygen that can be taken in from the environment, brought into the body by the lungs, transported by the heart to the skeletal muscle, and used to do physical work. It's the exercise physiologist's marker of fitness. And so when we hear the term cardiorespiratory fitness, that's what we really mean. And there are ways to estimate it. There are ways to measure it directly. Many of your audience will have seen or even participated, had a mouthpiece in their mouth and run on a treadmill till they can't go anymore. And that's how you measure the maximal oxygen uptake. Back in the 1960s, they did a lot of other things. You should see the pictures of these guys. There are catheters in the arms, catheters in the bladder, catheters everywhere. They measured heart size. There wasn't echocardiography then. So they measured heart size by X-ray. Now that takes into account both the mass, the muscle mass of the heart, and its volume. And the heart just shrunk in bed rest. So the heart shrinks, the muscles atrophy, and that's probably the single most important thing that happens, at least to the heart. The blood vessels adapt to to meet the demands that's placed on them. So the blood vessels kind of get a little smaller. Also, everything kind of contracts. And that's probably, if I had to pick one thing that would be the archetype of the bed rest, is the shrinking and atrophy of the circulation, including the heart.
And you said that they were trained after bed rest. So
Yes.
was this reversible?
Well, that's really interesting, right? Because out of those 5 guys, 3 of them were just average Joes. They weren't athletic, they weren't sick, they were just healthy college students. 2 of them were competitive athletes. One was a semi-pro football player, and the other was a distance runner. They all decreased by about the same amount. They lost fitness. But what was really interesting is that the 3 guys who were relatively unfit quickly returned to baseline and even got fitter than they were beforehand. For the fitter people, it took them the full 2 months to get back. And even then, they weren't quite back at where they were. So people whose bodies are adapted and trained, they lose the same amount, but it may take them longer to get back. And part of that may have to do with the load that's placed on them. So you have to kind of build back up slowly after you've been in bed for a while. And it just takes, people forget how much load they placed on themselves to get them back trained. And you can't just pop into that all of a sudden. You've got to build up slowly when you've been in bed. And we've learned a lot about this in the COVID pandemic, where people went to bed and were placed in quarantine and lost a lot of fitness. I will tell you, to me, one of the most compelling observations is in sticking with the COVID pandemic for a minute, because it really is the same concept. So you've heard about long COVID, for example, and people who have symptoms that last more than 3 months, 12 weeks after their COVID infection. Well, we were very worried when the COVID pandemic hit about what was going to happen to the athletes, because we were worried that they were going to get infected. We know that COVID could infect the heart. We were worried it was going to cause sudden death. And so we were very intensely monitoring all the collegiate athletes. And out of hundreds, if not thousands, of collegiate athletes who had COVID and went through a brief quarantine, how many do you think had symptoms that lasted more than 12 weeks? 1,600 in Brad Pettick's study. What percentage do you think? Make a guess.
8%.
Yeah. 0.06%. 2 people. 2 out of 1,600. Why is that? It's not that athletes are resistant to long COVID. No, it's because as soon as they got over their quarantine period, because they were in a competitive environment, they quickly returned to a trainer monitored and implemented return to play program. So it's really important for almost any condition, as soon as that forces you to bed, that you have to get up and start moving and progress your training to return to your baseline state. And in some cases, you can do even better.
So is the hypothesis that after being, let's say in COVID's case, like exercise may help protect against having this long COVID?
Absolutely. Now, let me caveat that by saying some people get really sick with COVID, right? And COVID can affect the heart and the lungs and the mitochondria and the muscles and the brain. There are all sorts of things, legions of things that can be injured by the body with COVID. So we're not talking about those people, right? Because that's a whole different story. What we're talking about people who didn't get that sick and had to be placed in quarantine, which often resulted, if not in frank bed rest, at least dramatic reductions in their physical activity.
Well, the other thing is that there was a lot of public health messages that were urging people not to exercise.
I know.
Because it was somehow, I don't even know exactly where that was coming from, but it was potentially dangerous.
Well, that's what we were worried about with the athletes, right? That because we would check them for troponin, which is a marker of cardiovascular injury. We do echocardiograms. We check electrocardiograms. That was called the triad. I was part of the Sports Cardiology Council that laid out those guidelines of the COVID triad testing. What we learned since is that really wasn't that effective unless the individual, the athletes, had cardiopulmonary symptoms. If they had palpitations or exertional shortness of breath or chest pain, those are the people who really needed more intensive evaluation to make sure that their bodies, their hearts, and their lungs had not been injured by COVID. We then went on to do cardiac MRIs in a lot of people, a lot of athletes who had abnormalities in this triad. And if they didn't have cardiopulmonary symptoms, they didn't have anything wrong with their heart. So we were deathly afraid of this because, for example, in the military, the most common cause of sudden cardiac death during basic training is myocarditis. That's an inflammatory infection of the heart muscle by a virus. And that remains and persists as a diagnosis, as a cause of sudden cardiac arrest in young athletes. So once this COVID pandemic started and we realized that it affected the heart, we said, oh my God, the streets and the playing fields are going to be littered with the dead bodies of young athletes. Fortunately, that was not the case. But we were worried about it. And I think it generated tons of publications and guidelines and things like that. And we learned a lot from it. It gets us back to this bed rest model that you had started talking about. In the original Dallas bed rest and training studies, we put people to bed for 3 weeks. And a lot of our high resolution physiology experiments have used that kind of 2 to 3 week model. And because at least in the early 90s, that was what we were doing in spaceflight, right? Bed rest is a model for spaceflight because you remove the head to foot gravitational gradient. So from head to feet, there is no gravity. So that's very expensive to do work in space. So we use bed rest as that model. But we put people to bed for a longer time than that. We've put people to bed for 2 weeks, 6 weeks, even 12 weeks of bed rest.
And this is like literally bed rest, like
bed
not
rest.
Getting up.
You can't even get up to use the toilet. We're talking strict bed rest. And that, that takes a little practice for people, by the way.
So how much of, is this bed rest a almost accelerated aging model? And how much of cardiac aging, what is cardiac aging? How much of it is due to being sedentary?
So that's $1 million question, isn't it? We found that the heart loses about 1% of its muscle mass a week in bed. So when we monitored people for 12 weeks, the heart just got smaller and smaller and smaller. Now, obviously, it can't get continued atrophy forever. And we've sort of used spinal cord injury as a model for what that plateau is. How low can you go? And it's about 25%. So patients with spinal cord injuries have about a 25% reduction in the mass of the heart. We see the same things in young women with a disease called POTS, or the postural orthostatic tachycardia syndrome. We can talk more about that later if you want. I know that's not your prime focus. If we take people and look either cross-sectionally, if we train them, we can see at least a 15 to 20% increase in the size of the heart. And if we look cross-sectionally, comparing elite runners to spinal cord injury, it's a 75% change in cardiac muscle mass. Is adaptable, plastic, responsive to changes in physical activity. So, we asked just the question that you asked, Rhonda. How much of what we see with normal healthy aging is due to becoming sedentary? One of the first studies we then did to follow up on the Dallas Bed Rest and Training follow-up study was we went out and recruited a group of extremely healthy but sedentary older people. It's not so easy to do, by the way. These are people who had no chronic medical problems, were taking no medications except for perhaps cholesterol-lowering medication, but just didn't do any regular physical activity. And we compared them to a group of elite masters athletes. These were individuals who trained virtually every day for much of their adult lives and were competitive at the regional and national level. And we used a technique that we developed in my laboratory to estimate and to quantify let's call it the flexibility or stretchiness of the heart's muscle. The medical term is compliance, but it's really how much will the heart stretch? And we all think about aging. You think about aging of the skin, for example, right? That it becomes less stretchy, it becomes stiffer. And the analogy I like to give people is with a nice brand new rubber band, right? Take it out of the box, stretch it stretches great, right? Stick it in your junk drawer, right? And come back 20 years later and take it out of the drawer and try to stretch it again. It doesn't really stretch. It loses that stretchiness. And there are a number of specific biological reasons why that might be, and we can talk about that. But that becomes a really good marker for the cardiovascular system. The compliance, or the ability of the heart to stretch and accommodate blood, not just the heart, but the blood vessels also, is a marker of youthful cardiovascular structure. So we stick a catheter in the heart. We put it in through a vein in the arm. We then unload the heart. We reduce its volume by using a procedure called lower body negative pressure. Basically, you put someone in a box sealed at the level of the hips, hook it up to a vacuum cleaner and suck. And we can literally pull all the blood out of the heart. So we can make the heart smaller and measure the pressure and its volume using echocardiography. Then we give them a volume load. We put an IV in and we blast salt water into the heart and we make it bigger, as big as we can get it.